I think there's a narrative in the industry that healthcare is usually the slowest to adapt new technology. And I see you're already smiling there. And I know we've had a few conversations about this before where, you've pushed back a little on that. So just for the audience here, like what's your take on this statement, right? Is healthcare really lagging? Is it just being, appropriately careful? What is the nuance around healthcare industry adopting new technology?
I think it's a really great question. And I'm certainly following industry trends. I'm really collaborating cross-functionally in medtech. And I've spent a lot of my role, patient access, customer service, really focused on those outcomes. And I think that at the end of the day, I wouldn't say that healthcare is lagging. It's more we've got to be very careful and cautious across this space to ensure that those outcomes really are meaningful. And I think that adoption of technology, in my opinion, is that we ought to really understand our customers and make sure our data is at a place that technology offers the right outcome or at least the right kind of choice. I think it's really important to make multiple channels available. Our patients and our customers are busy. They have many things, competing priorities that they're really trying to stretch themselves across. And so making ourselves available to our patients and our customers through technology channels really is about meeting them where they are. And so it's a really profoundly important space, and thinking about multiple channels is really trying to put that customer patient outcome at the heart of our experiences. And I think that's really what technology adoption ought to be, and is at least what I'm seeing as I'm exploring all the options out there. So I think that it's really about adopting in a meaningful way and ensuring that your data allows for those tech touches and those channel experiences to be as good as an experience interacting with one of our team members. But it really expands our access, and that's really what it's all about.
Yeah. And you made a really important point here. You talked about, being there's caution, right? It's not about the healthcare industry lagging in adopting new technology. It's just being more cautious. I mean, I know from a lot of the healthcare prospects and customers that I work with, I understand where that caution is coming from. But are you in a position to share a little bit more on what is the actual cost of getting AI run in the healthcare contact center space compared to
Um,
other industries, if you will?
yeah, I think this is something that I'm hearing across all domains, not just healthcare. I think the big lift is coming down to the reality that many of our industries have spent so much time protecting our customer data sets, patient health information especially, and you're really mindful of all the regulatory frameworks across the different countries that you operate in. And so you've really got to be mindful there, bringing to life AI, bringing to life meaningful AI touch points really comes down to bringing these different data sets that we've done a really good job of siloing and protecting, and bringing them together to ensure that we can create that longitudinal context, where we really know who we're talking to, why we're interacting with them, what their needs might be, and imagining a world where we can anticipate, and through that anticipation, through historical experiences with our companies, really it allows for us to predict what that, customer patient might want. And then again, it really does allow us to um, implement this technology in a way that is a good experience externally. Cost, I think it really comes down to assessing what is the core technology that's going to be in that ecosystem that drives that external experience. And what I've seen, and in my opinion, it's really about starting internally, looking at what problems you want to solve. Is it an inefficiency? Is it a lack of capacity? Is it a lack of onboarding speed? Is it a lack of expertise in certain areas? I think it's really about exploring internally how you can remove friction, and implementing these tools in that context. And that allows not only for it to be more of a cautious approach to ensure we're really fine tuning what you want to do before it is external, but ultimately, you know, in all the environments I'm collaborating in, it's very difficult to bring all those data sets together quickly. So really trying to identify those meaningful data sources to bring to life that context. And I think that internally, it also drives a bit of that change management where you have employee experience being enabled and changing and allowing those team members to understand they play a really important role in that oversight as you think about expanding tools and technology, you know, potentially to that external context.